In Kentucky's heartland, this is Trump country, deprived in parts with people depending on health support. Queuing up at a mother and baby clinic, it's an opportunity for health insurers and advisors to explain the complicated US health system.
Do you have health insurance?
Yeah, I have Blue Care.
Okay, good.
They try and help the many people on low income in this part of Kentucky. Kathy Oller advises people how they qualify for government help if they have a low salary, or insurance if they work and pay towards their health care.
We're educating Kentuckians, and we're also guiding them through the system of choosing plans and seeing if they can afford it.
Nearby in Corbin, friends discuss health care costs. Bobby Smith has had breast cancer and says health insurance is becoming more expensive.
I think they need to bring the prices down.
I do too.
Like Donald Trump, they believe health care needs reforming.
It seems to me that the insurance companies are dictating what treatments people can have, paying for certain medications and not others, and they won't always pay for the medications prescribed by a doctor.
So it's less about the health, it is more about business.
Sounds like it's more about business to me than it is about health.
Corbin is where one of America's fast food companies originates from. But in this part of Kentucky, as well as a lack of jobs, there are health problems, some which relate to how people live. Nevertheless, with Obamacare and extending Medicare, millions more Americans have access to some kind of health service. Despite that, a majority in this state voted for Donald Trump in last year's election. But Americans in poorer states like Kentucky will lose out if Trump cuts the costs associated with offering health care to families like the Browns, who don't have much income.
Yeah, I'm hoping he doesn't just take it all away. He does something to replace it in some way. Because if he took it away, then this area would be just stricken.
If that's too expensive, then they're going to have to eliminate people to save money. So, and more than likely that would affect my family.
In Frankfort, the state capital, Kentucky's new Republican governor is trying to slash a $300 million Medicare cost after more than 400,000 Kentuckians enrolled on the scheme.
The system is kind of unsustainable on both ends. Both the state can't afford to continue to pay the Medicaid rates that they're paying right now, and the individuals can't afford to pay the individual plans they're paying for.
With a third child on the way and Josh struggling to find a full-time job, losing health care would affect this family more than most. Iolo Dafydd, TRT World, Whitley County, Kentucky.